The challenge for commissioners in Lancashire has been identifying provision in the community that can meet the needs of individuals with very complex needs. Pendle Gardens facilitates the discharge of individuals from hospital and secure settings into the community. It's the first model of its kind in Lancashire. It's a bespoke service with a highly specialised support team, and what we're working to do here is to enable people from Lancashire to remain living in their home county. Pendle Gardens offers accommodation and support to up to 8 males who have learning disabilities and additional complex needs, including perhaps autistic spectrum conditions, mental health conditions, personality disorder, or behaviours that could put themselves or others at risk. One of the biggest challenges has been ensuring that once individuals are discharged from hospital, their placements in the community don't break down. What Pendle Gardens seeks to do is to bridge that gap between hospital provision and community living, for example in supported living. Being a flat-based service enables us to mitigate against compatibility issues, which can often be an issue when we're looking to discharge individuals from hospitals. So individuals get an opportunity to learn to live in a flat, often for the first time, to learn the independent skills that they need, at the same time to have that wraparound support to ensure that there's no risk of placement breakdown and they can enjoy the kind of quality of life that they deserve.
Many of the barriers that we've faced have been about finding the right setting for people to be discharged to, in the right environment, finding providers with the right skill set and the right set of values, and to be able to uphold the values really that we're looking for people.
The location of Pendle Gardens in Barrowford offers individuals living here an opportunity to enjoy the beautiful local countryside that we've got. In addition to being in walking distance of the centres of Barrowford and Nelson, Pendle Gardens is located on bus routes which can take individuals to larger local towns such as Burnley, Blackburn. There is the railway, and we're also close to the motorway network.
Everyone here at Pendle Gardens has support workers who act as key workers for each person using our service, who will ensure that their needs are being met. So if someone wants to plan a day trip to Blackpool, for example, the key workers will take the lead on that, and it gives the staff team that autonomy to try and implement new approaches, but with engaging with the individual on a level that centres around their needs. Then on top of that, we do a key worker monthly meeting. We might discuss any areas of support plans that we might need to visit if someone's struggling in certain areas, certain aspects, and kind of come up with some positive actions for how to improve those areas for them. At Pendle Gardens, we want people to feel part of the community that they are living in, and to enable that, we support people to engage in meaningful activities, which may include some charity work, taking part in localised activities, and helping them to build up those community relationships. We've got a wide range in experience from the staff team, so people that have worked in hospital settings, community placements, someone who's a qualified social worker, so we have that experience within the team, and we're confident and we are able to meet the needs of people moving in and their changing needs. Also, we have access to specialist intervention teams. We have a practitioner who will come and support us with looking at positive behaviour support interventions to improve the standard of living for the people that we support. As well as the PBS team, we can request the support from our autism specialist, who can provide additional support in meeting autism needs.
I think having a mental health nurse in the service provides different perspectives from a nurse's point of view, as well as having support workers and management. It just provides more of a clinical role.
It's been a pleasure to visit, to see the setting and how rural it is, but quite close to the local amenities. But as much as anything, it's about the quality of the spec within the flats themselves and the opportunities that that's going to give for our individuals who will be moving in here.
The vision for Pendle Gardens is to offer people from Lancashire who have learning disabilities and complex needs an opportunity to have a home in the local community, to enable people to be discharged from the long stay hospitals and to build valued and meaningful lives in the community.